Hi, everyone. How are you? I am Bevanisha Mudio Sawaru from Jamaica, and I'm happy to be here with you. Today's presenter at the Spiritual, Physical, Emotional Cleansing Training is, of course, Dr. Santy Kit-Ling Lee. She earned a PhD in clinical psychology at a California university. Her postdoctoral study was on brain health and behavior. She is an American clinical marriage and family therapist. She has also received certificates, numerous certificates, from a College of Nutrition in Toronto. You can find her talks from number 11 to 51 on her YouTube channel called Messianic Healing. And talks 1 through to 10 can be found at House of Israel, UK. Today's title of this talk number 52, is mental and physical symptoms from malnutrition and plants, part 2. Let's welcome Dr. Santy Kit-Ling Lee. Welcome, Doc.
Thank you. Thank you for introducing me. Okay, let me go to share screen. Okay. We have to, okay, let me see if I can go to share screen.
We can see it.
Yeah. Okay. Yeah, so, okay. So,
yes, you're screen sharing now.
Yeah, but I cannot see very clearly the full. Yeah, there you go. What did you press?
Right down here.
Okay, good. Thank you, Lisa, for introducing me. Okay, I'm so happy we have new member, Janelle from Quebec, Canada. Everyone welcome her.
Hello. Welcome to the family. Welcome to
Yes.
class.
Wonderful. Okay, today I follow up with my talk one. Today is part 2, mental and physical symptoms from malnutrition and plants. Okay, I've been talking about carnivore diet, the benefit, and comparing carnivore diet and plant-based diet. And today I'd like to give you a more broader information. Let's go to introduction. The major causes of mental and physical symptoms originate from stress. So we have to deal with our stress, negative mindset, and vitamin mineral deficiency. I guess you all know that. I mentioned this many times. Okay, so therefore the conditions, your body and emotional conditions reflect low immune and inflammation in gut-brain connections. They are due to gut, liver toxicity, difficult birth, and cesareans. I found out some research on cesarean. People, they request the doctor to open the womb to take the baby out at a certain day and certain time, according to the Buddhist Bible. Isn't it terrible? But the baby couldn't get the right kind of stimulus in the brain, and the IQ lower than the normal birth IQ baby, and also the mom experienced viral infection possibly. Okay, that's not typical way of giving birth unless critical condition. Today, the modern living and eating culture bring us sickness. It is worthwhile to explore reasons of essential nutrition deficiency imbalance of amino acids due to lack of good oil and complete protein. Today, my talk covers in more detail the conditions of a combination of mineral and vitamins for assessment and treatment. Essential nutrition deficits. A, causes of essential nutrient deficits. Deficiencies. Poor food choices. Poor digestion. Poor absorption. Food allergies. Intestinal injuries. Bowel flora imbalance. Do you have good bacteria in your in your gut? Drug interference with metabolic processes. Increased requirements of nutrition, nutrient for conditions such as drug detoxification, genetic condition. If we have some gene that's defects, congenital, that's environmental after birth. Lifestyle, we don't have healthy lifestyle, not do exercise frequently, or the sleep, we don't have enough sleep, or don't sleep at the right time. Athletic performance, some athletes, they have to use specific kind of supplement or food to increase the performance. That may cause side effects too. Like they like to eat whey and that kind of artificial protein. I remember my nutritional teacher, he opposed people eat whey. Why don't we directly get nutrients from meat and plant? An environmental situation, as you know, that we suffer from chemtrail, the airplane dropped the aluminum in our air. Non-essential substance for producing hydrochloric acid and digestive enzymes. Lacking fiber in refined food. Lacking fiber. That means we have to be careful on the selection of food. Try to stay away from refined food as much as possible. That means you cook your own meal. Okay, so negative effect on drugs, poor bowel hygiene, destroying friendly bacteria. The food or chemicals is eliciting most severe mental illnesses. They include wheat, because wheat has gluten, because milk has casein, cane sugar, tobacco smoke. If you don't smoke, it destroys your health completely. Destroy your lung, destroy your brain. And even eggs. Well, be careful of eggs. Don't take too much egg, especially they are not organic. Number B. Okay. B. Sources of deficiencies. Why we suffer? What the page I just mentioned. Why? Number one, gaps in knowledge. Have we learned all those things from our school? No, I don't think so. Lack of organization, no voices to educate correct nutritional knowledge. Degenerative diseases, including fibromyalgia or other autoimmune diseases, can be reversed by vitamins, minerals, and essential fatty acid. Vitamin E stop rancidity of EFA. So vitamin E can cure malaria. fully informed decision is to resist damaging treatments by drugs. Okay, be careful. I mean, pharmacies, and surgery and radiation. Be careful of the invitation of annual breast cancer examination. You have to put woman put your breast to expose to radiation each year in Canada. Come on, why do we need to do it? There's so different healthy way to examine your body healthy or not. Number 2, essential nutrients and fiber loss during processing. How many processed food you have been taking? Whole grain is become white flour. You go to a bakery store to get a white flour bakery. The percentages of nutrients lost, I give you example. Excuse me. Calcium lost 60%. Cobalt lost 89%. Manganese lost 86%. Magnesium lost 85%. Vitamin B1, B2, B3. The range will be 70 to 81%. Vitamin B6, 72%. Vitamin E, 86%. Linoleic acid, 95%. Alpha linoleic acid, 95% again. Fiber, 95%. White rice, you lost 26 to 83 of mineral percent, but then and also mineral on brown rice. 80%, 83% of mineral on brown rice, but white rice, that I find that the vitamin B at the shell of brown rice would be better than white rice. However, high oxalate in brown rice than white rice, so don't eat them every day. Sugar, 83% to 100% in raw sugar, even. Fat-free milk, all manganese, selenium, vitamin A, D, and E. Okay, so be careful you choose the fat-free milk. Half of the calories in North American diets from nutrients loss. Isn't it terrible? Many North American diet, they use all those white flour and cheese. Come on. Okay, number 3, deficient food. People craving for sugar, cheese, I just mentioned. Trans fat diet. Oh, how many of us like to eat chips, like to eat fry, go to McDonald's, take fries, okay? That then we damage our body. 8, whole wheat is made with white flour, add a little bit of grain. They call it grain muffin, but only small amount would be from grain. And B, margarines and shortenings inadequately metabolize the saturated fatty acid in processed oils and products like mayonnaise, dressings. Why don't we make our own dressing? Or even when I eat salad, I don't use dressing. Or I can add a little bit of lemon juice in it. All these result, this man-made seasoning result in cancers. You go to this source, the Maple, Canada. to find the reference. Number C, sausages. Who don't like sausages? Many people like it. And processed meat. They contains cancer-inducing preservatives like nitrite. Vitamin C block nitrite toxicity. Fillers in the sausage and processed meat. Fillers include like refined starch and saturated oils, causing indigestion and pain. Okay, come on. If you suffer from pain, then you have to ask yourself, have I ever had a sausage and processed meat? Maybe some of the causes. Okay, no nutrient necessary for biochemical functions. Again, from Herald Monthly. This is from the Christian newspaper in Toronto. And Mingbo, as I mentioned again, this would be the reference. Let's see the next page. Conditions for combining vitamins, minerals. I give you some conditions that many people don't know the importance of nutrition, and the psychiatrists keep or psychologists keep treating the following conditions, especially treat schizophrenia and manic or major depression, unsuccessful. Why? I tell you why. Let's look at the condition. Number A, pyroluria. Let's look at the origins of this condition. It's stress-related condition beginning in teenagers' year after this person exposed to a stressful events and untreated, unidentified. Symptoms are recursive, depending on close circle, avoiding any stress. After this stress, that person cling to the close circle. Result in weak ear infections as a child. When this person suffer from pyroluria, check the childhood history. When this person is a child, may suffer more ear infection, colds, chills, fevers, fatigue, exhaustion, anxiety. I'm talking about not only childhood, that's from childhood until adulthood. Exhaustion, anxiety, insomnia, seizure. Oh, come on, seizure can be treated. I apply liquid of magnesium on the area, then the seizure stop easily. Memory loss, hyperactivity, learning disability. Hey, have you ever discovered all those? Okay, they can, those symptoms I just mentioned would be quite similar to a attention deficit hyperactivity disorder. Yeah, there's a similarity. Oh, this person cannot think clearly. And very significant feature would be paranoia, confusion. I put both on these two words. And pyroluria, the major symptom would be paranoia, confusion, depression, mood swings, irregular periods, impotence, bad mouth. Okay, well, this is one of the characteristics. Strange body odor. You walk past by this person, you cannot stand the odor. Poor tolerance of alcohol or drugs. Waking up with nausea, cold hands or feet, abdominal pain, unable to recall dreams, pale skin. Oh, this one, a white mark on the nails. Oh, that reflect symptoms of pyroluria. But however, if this person improve the nutrient, improve the diet, this white marks may be disappear. Poor hair growth, loss of hair color, acne, eczema, high blood sugar, protein indigestion. If your gut cannot digest protein well, and then the brain will be damaged, and the whole body you suffer pain, and the whole body be affected negatively, easily being diagnosed. Although symptoms, but many psychiatrists they focus on paranoia and confusion, so they thought this person has schizophrenia. Okay, let's look at the second condition. It's called histamine imbalance. Histamine imbalance, another name is histolia. It can be detected by blood tests. What are the symptoms? This is very significant. Obsessive compulsion. Okay. Obsessive compulsion. There's another condition. People not necessarily suffer from high histamine, but histamine may not apply to everyone who suffer from obsessive compulsion, but those who have obsessive compulsion may indicate this person may have high histamine or hysteria. Okay, again, the symptoms include obsessive compulsion, piece of depression, suicidal thought. Oh, so this is quite a little bit different from the pyroluria. You trace the history, if this person contemplate suicidal thought or not. Headache, migraine headaches especially, sneeze in sunlight, easily cry, salivate, feel nauseous, abnormal fear. Okay, people they have compulsion reflect lots of fear, unreasonable fear, abnormal fear. Rituals, of course, wash hands 100 times, of course. Compulsion, obsessive compulsion. Attention, driven feelings, always, people suffer from ADHD, always, the brain always on the go, or on the run. They also sometimes cohabit with obsessive compulsion. Easily orgasm, fast metabolism, eat a lot and still feel hungry. High body heat, good tolerance of alcohol. This is I just mentioned about pyroluria. They you can tell the difference, right? Okay. But this one is high, good tolerance of alcohol, but pyroluria, poor tolerance of alcohol. You can tell the difference. Okay. Seasonal allergy. Oh, this would be similar to the former one, but this one, the allergy is seasonal, not year-round. Shy, or similar to the last one, pyroluria. Oversensitive as a child, similar to the last one. Large ears, long fingers like and long toes, skinny, less hair, and light sleeper, or easily wake up. Okay, I just mentioned about condition of high histamine. Now there's people who have low histamine, shows they suffer from anxiety, paranoia, and hallucination. Oh, come on, schizophrenia also have paranoia and hallucination. But that doesn't mean this person suffer from schizophrenia. It just reflects the body has low histamine. Okay, go back to high histamine type. They they are suitable for low protein diet. I've been saying a lot on the benefit on carnivore diet, but if this person have high histamine history, I suggest low protein diet. Protein can get from different sources like meat protein or vegetable protein like beans. But I mentioned about the dangers of beans in my previous talk. Okay, so you have to make a right choice. As carbohydrates and meat containing, okay, let me explain why this person suitable for low protein diet. Carbohydrate and meat containing amino acid further increase its level. It is histamine. So this person already suffer from high histamine, and then you don't need to add more. So you use vitamin C is the antihistamine, 2 grams per day with 15 mg of zinc, 5 mg of manganese, 50 mg of B6, 500 mg of calcium, 5 mg of methionine. Let's look at the next slide. Okay. Oh, I'm reminded we don't have much time. Okay, Dr. Pfeiffer found Histamine runs in families. Onset is 20 years old with history of suicide, depression, and allergy. Histamine composes about 20% of so-called schizophrenia and large proportion of depressed people. So they were regarded as depression or schizophrenia. The underdiagnosed hysteria does not respond well with any treatment if you treat them as schizophrenia. Number 3 condition, Pellegra. It is serious B3 niacin disease represented by 3Ds, diarrhea, dermatitis, and dementia. It is correlated to the corn eating or rice eating culture. Middle and Central America use corn quite a bit and rice quite a bit. Corn is low in tryptophan and its vitamin B3 and niacin is bound. It is a dietary deficiency disease. Niacin stops the brain to produce adrenochrome from adrenaline, which induce hallucination. Oh, come on. So if you lack of niacin, be careful. Acute schizophrenia needs high dosage of niacin, 1,000 to 2,000 mg with vitamin B12. Put it under the tongue. Folic acid, essential fatty acid. Okay, next page. Chronic schizophrenia with pyroluria and low histamine is not suitable to use high doses of B3 and folic acid. Niacin with vitamin B12 and folic acid rise abnormally low histamine level, causing hallucination. That's why you have to be careful what condition you use. Niacin affects brain functioning. It uses fatty acid to happy neurotransmitter serotonin to treat depression. However, flushing B3 detox copper and other elements linked with mental illness. Also increase oxygen in the brain. You can find my top 50. I suggest niacin can be found richly in beef liver. Let's talk about carnivore diet and plant. Carnivore diet and plant diet have been discussed in talks 43 to 50. Many critiques review of the carnivore diet have been addressed. Fiber fails in from my talk 47 to 49 mentioned that fiber fails to cure small intestinal disease, diverticulosis, colon cancer or cancer, colon cancer prevention, mortality, diabetes, weight loss or body weight increase, cannot solve a cholesterol problem, cannot solve insulin problem, cannot solve brain heart problem. So carnivore diet may be a choice for you. However, some people may not fit for complete carnivore diet, include high histamine. I just need because the characteristic would be similar to the one type of ADHD. There are 6 types of ADHD, attention deficit hyperactivity disorder. One type is called overfocus. If this person has overfocus, is not fit for 100% carnivore diet, but it doesn't mean cannot eat meat, but not 100%. And people, they don't have blood type O, may not fit complete 100% carnivore diet. So you have to make adjustment, mixture of some fruits and vegetables, but make sure those fruit and vegetable have low oxalate. Vegetarians insist that eating meat is acidic to the body, but they don't know acidity from the meat can be neutralized with lemon juice. So you always drink lemon juice to neutralize, because the lemon juice go into your body, become alkali in your digestive system. Let's look at the conclusion. Ignorance and being tempted by the chemical, pharmaceutical, and food industry. Eating modern day diet, including constantly drinking coffee, especially the non-organic coffee, sugar, chips, I just mentioned, create a loss of nutrient deficiency, and they don't know unknowingly, resulting in mental and physical illness and disability even. Degenerative disease can be reversed by proper vitamins, mineral, positive thinking, exercise, and touch of nature. It is important to promptly identify the root cause of all sickness or deficiency to avoid the damage of under or misdiagnosed or mistreatment. Hysteria or pyroluria has been easily seen as schizophrenia or manic depression, I mentioned earlier. Gaining correct knowledge in food, learning essential nutrients and its impact to make a complete informed decision, end up in restoration of your healthy mind and body, even spirit. Okay, I use the following information to come up with today's presentation. Okay, so I use almond healing ADD to mention the whole overfocus type of ADD, and also I use this group Eldor to talk about the birth, giving birth, and also the third book I use Facts That Heal, Facts That Kill, very powerful book. And also this guy has, I mentioned this book many times, Staying Healthy with Nutrition. And also this article, Can allergic exposure provoke psychological symptom? Very useful research. Another book by Harvard, this book by Harvard, I also recommend